I am Dr. Jaswant Singh. I did my graduation from Medical College, Amritsar. I did my MBBS from there as well as I did my MD in General Medicine from the same Government Medical College, Amritsar. After that, I have been posted in Punjab Civil Medical Services for about 10 years. I was working as a senior lecturer in Medical College, Amritsar. And after few years, I started my own practice in Nagpur. Now I run my own nursing home as well as my consulting practice in the city of Pathankot. Now the topic today is understanding hypertension. Everybody knows that hypertension is a very common problem encountered by physicians, and every patient, every doctor wants to understand this topic, and he wants to tell his patients that how they can manage their hypertension. Generally, everyone would like to have healthy or normal blood pressure. But what does it mean? What is the basically each time when the heart beats, it pumps blood into the blood vessels. This creates pressure against the walls of the blood vessel. This is called blood pressure. This pressure against the walls of the blood vessels is the blood pressure. Normally, in healthy persons, it rises and falls throughout the day. But when blood pressure remains high for a longer time and left untreated, it can lead to serious health complications. In general, persistent increase in blood pressure higher than normal blood pressure is known as hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices. For example, not having, not having enough regular physical activity, obesity, smoking, stress, etc. There are other risk factors that can also increase the risk of developing hypertension, such as age. As people get older, the arteries can stiffen up and narrow, and as excess fat builds up. Similarly, family history of high blood pressure. One or more close family members with hypertension increase person's risk of getting hypertension. Excess salt intake is another factor for raise of blood pressure. Not eating enough foods with potassium can increase blood pressure and the risk of stroke and chronic kidney diseases. Similarly, eating processed and fatty foods increases fats throughout the body and makes the heart work harder to push blood through the body, hence causing blood pressure to rise. On the other hand, lack of physical activity is also linked to obesity and further rise to high blood pressure. Lastly, another factor is stress. Reacting to stress in unhealthy ways or not managing stress can also increase the blood pressure. Now moving on, hypertension doesn't have any obvious signs and symptoms. It is a disease which is hidden and which is not seen. But that's why it is often called a silent killer. It puts people at risk of several diseases, from cardiovascular problems to kidney failure, stroke, and even eye damage and blindness. Hence, early and accurate diagnosis of hypertension and its management of hypertension is very important. First of all, measuring the blood pressure is the only way to know whether a person is having high blood pressure or not. Generally, when symptoms do occur, they include morning headaches or tiredness, vision changes, fuzziness in the ears, and fatigue, nausea, or vomiting. If a person is experiencing some of these symptoms, then one should get his blood pressure checked from the physician. Fortunately, high blood pressure can be easily diagnosed. It is usually measured with an instrument called sphygmomanometer. A blood pressure recorded in numbers, two numbers, systolic and diastolic. Now let's try and understand what these numbers actually are. A healthy or normal blood pressure should be lower than 120/80 millimeters of mercury, or it can also be correct as 120/80 millimeters of mercury. Here the number indicates systolic blood pressure, which means pressure in the blood vessels when the heart contracts, whereas the lower number indicates diastolic blood pressure, means the pressure in the blood vessels when the heart rests between the beats. If blood pressure is more than 140/90 millimeter of mercury, then the person has hypertension. If person have blood pressure levels higher than this, he or she might be at a risk of developing serious heart diseases. This risk can be prevented and reduced by taking steps towards a healthier lifestyle such as regular exercise, healthy diet, third, quitting smoking and regular blood pressure monitoring, stress management, and adherence to the medications. If blood pressure is successfully controlled with such lifestyle modifications, then it means it might avoid, delay, or even reduce the need for medication. So let us look at these strategies one by one. Number one, regular exercise or physical activity is number one in treating or managing hypertension. Exercise can be drug-free approach to lowering blood pressure. Regular physical activity makes a person the heart stronger. If one have a strong and healthy heart, it can pump more blood with less effort. So if heart has to work less to pump, the force can be blood vessel with increase and lowers the blood pressure. If in other cases as well, we are aware that age and weight gain are two major risk factors for hypertension. So if the blood pressure is a desirable level, that is less than 120/80 millimeters of mercury, then exercises can also prevent it from rising further with the progression of age. As regular exercise also helps you maintain a healthy weight, which is, in my opinion, an important way to control blood pressure. One should aim at least 30 minutes of aerobic activity most days of the week. High blood pressure levels can reduced doing regular exercise, structured exercises such as brisk walking, jogging, and swimming, etc. These are the lifestyle changes. Number two is the healthy diet. Diet also plays an important role in controlling hypertension. A diet with high intake of vegetables, fruit, and whole grain recommended for hypertension patients. For lowering blood pressure or preventing hypertension, through dietary intervention, one can adopt a dietary pattern such as DASH diet, or it is also called Mediterranean diet. Number two, eating less saturated fats and total fats. Getting plenty of potassium, which can be got from fruits, etc. Limiting the amount of sodium in the diet. These are the four parameters for healthy diet. First of all, DASH stands for dietary approaches to stop hypertension diet. Eating a DASH diet that is rich in whole grains, fruits, vegetables, and low fat dairy products, and skims on saturated fat and cholesterol can lower one's blood pressure by up to 11 millimeter of mercury if having high blood pressure, which is quite significant. Number two is the reduction of sodium in your diet. Even a small reduction in the sodium in the diet can improve the heart health and reduce blood pressure by about 5 to 6 millimeter of mercury. If you have high blood pressure, to decrease sodium in your diet, you can consider tips like this. Number one, read food labels of different diets. If possible, choose low sodium alternatives of the foods and beverages one normally takes. Eat fewer processed foods because processed foods have high sodium levels. Only a small amount of sodium occurs naturally in foods. Most sodium is added during processing. So you can eat natural products which are mostly without sodium. Not add salt to your diet. Just 1 teaspoonful or of salt has 2300 milligram of sodium, and which is enough dietary consumption of sodium per day for a normal person. Avoid adding salt to your foods. Use herbs or spices instead of salt to flavor your foods. Third is the smoking. Quit smoking. Stopping smoking helps your blood pressure turn to normal. Quitting smoking can effectively reduce your risk of heart disease and improve your overall health. Then fourth is the regular blood pressure monitoring. Some of the hypertensive patients don't check their blood pressures very frequently. But it is not always possible for patients to always come to the doctor for getting their blood pressure checks. And their blood pressure, hence, most often I advise patients to do self-monitoring of blood pressure levels at home, which must be done with a good BP apparatus so that you can make a good chart of your blood pressure levels and show your physician and what your blood pressure levels have been when you visit your doctor. Self-monitoring helps persons to measure blood pressure at different times of the day, and throughout the day and over a longer period of time. It also assists doctor to get more complete picture of the person's blood pressure readings at different times of the day. It further helps us in better prediction of cardiovascular morbidity and mortality rather than single routine blood pressure measurement at the clinician's office. And this is very important because at home you can measure your blood pressure at different times of the day, which is not possible by visiting the physician. Fifth is the stress management. By learning how to relax and manage stress can improve emotional and physical health and lower high to high blood pressure. Stress management techniques include exercises, listening to music, focusing on something calm or peaceful, and yoga meditation, which is really effective in lowering blood pressure and your stress management. Stress is an important factor in causing hypertension. Six is adherence to medicine. A medicine to lower blood pressure may be recommended by a doctor. If your blood pressure is consistently high, usually at or above 140 by 90 millimeter of mercury, adherence to medicine is very important as it controls your blood pressure regularly. At least, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyles can help us to enjoy long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping 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 blood pressure in this normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. This is very important, preventing of high blood pressure and getting rid of the complications of blood pressure. And techniques include exercises, listening to music, focusing on something calm or peaceful, and yoga meditation. Lastly, adherence to medicine is an important factor in the treatment and prevention of complications of hypertension. A medicine to lower blood pressure may be recommended by a doctor if your blood pressure is consistently high, usually at or above 140 oblique 90 millimeters of mercury. Adherence to medicine is very important as it controls your blood pressure regularly. At last, I would like to suggest that there is nothing more precious than having a fit and healthy life. Adopting healthy lifestyle can help us to enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. Keeping blood pressure in the normal range is very important in preventing cardiovascular complications. It is very much possible to maintain normal blood pressure levels with regular monitoring and preventive care. Because blood pressure is a disease which is preventable as well as treatable. If the blood pressure levels are not too high, then they can be usually prevented with our diet management techniques, stress management techniques, and the other things I have just enumerated. But if the blood pressure is beyond the normal range, then there are a good number of medicines which are available for the treatment of blood pressure. Blood pressure or hypertension is a silent killer, and we must treat it adequately to prevent the complications of blood pressure. Treating blood pressure is more important than just keeping it in yourself and having complications later on.